There is as much wisdom in listening as there is in speaking. Daniel Dae Kim. This is the story about how I learned the importance of giving recognition to how a patient is feeling, utilizing silence, and listening. On one of my first days of clinical, I worked with a patient who we'll call John. He was a man in his 50s who was diagnosed with major depressive disorder and was being treated at Baystate Franklin. Major depressive disorder is marked by a depressed mood or loss of interest or pleasure amongst at least 4 other symptoms that are present for a 2-week period or longer. When I first started talking with John, immediately I could tell he seemed very down. He looked at the floor for most of our conversation. I started with simple conversation, asking questions such as, "How was your breakfast?" and "How did you sleep last night?" John responded very slowly, as well as spoke slowly. The silence made me feel uncomfortable. Should I keep asking questions? What do I say? I thought to myself. I felt like I should keep asking questions to fill the silence and speed up the conversation. I began to ask John more about how he was feeling. He told me that he's had a history of depression and wants to be better. He had told me that last week he laid in bed the whole week, but this week he started to make his bed to keep himself out of bed and was making himself read his book. He seemed to light up when he started talking about his book. I focused on that and bringing the conversation to positivity. After this conversation, I didn't feel great. It took me till sitting in class and learning about major depressive disorder to realize what I could have done better in this conversation. In the lecture, I learned the importance of allowing time, listening and reflecting, and not trying to solve a patient's problem and bring them to positivity, but to be present with them. In an article titled "Enhancing Adult Therapeutic Interpersonal Relationships in the Acute Healthcare Setting, an Integrative Review," writers find that therapeutic listening, responding to patient emotions and unmet needs, and patient-centeredness were key qualities used to improve therapeutic relationships with patients. I realized that in the conversation with John, I was so focused on filling the silence, I was not properly listening or giving him time to respond at his own speed. If I had had the opportunity to redo this conversation with John, instead of speeding the conversation up, I would have taken a step back and had the conversation at the patient's speed. I would do a better job on using silence and listening to what the patient was saying. I would ask the patient more about how he was feeling when he was laying in bed and validate that, instead of trying to bring him to a positive place and steering him away from how he was feeling. This learning experience really taught me the importance of validating how a patient is feeling, listening, and using silence. After this experience, I was able to work with a similar patient later in the semester. After learning these new skills, I think I was much better able to facilitate therapeutic conversation with this patient. This is a skill I've worked on this semester and hope to continue working on. Thank you for watching.